Demonstration on patients. Case 1. A 52-year-old male patient presented in the clinic with concern about his decayed lower anterior teeth. The patient's medical history was non-contributory. Intraoral examination revealed that the lower right and left central and lateral incisors and the lower right canine were grossly decayed. After radiographic examination, it was confirmed that the lower right and left central and lateral incisors and the lower right canine had caries with pulp involvement. The crown structure of the lower canine was compromised due to caries. The planned treatment was explained to the patient. Root canal treatment was carried out for all the concerned teeth and a post was indicated for the lower right canine. Post-obturation radiograph of the lower right canine signifies that it is a well-obturated tooth with a hermetic seal and no periapical pathology. This is an ideal situation for a tooth to undergo post and core procedure. The choice of post depends on various factors like length of the post, pattern of destruction, amount of tooth destruction, location of the tooth in mouth, and flexibility of post compared to that of the tooth. There are two schools of thoughts to determine the length of the post. The first thought says that the length of the post should be equivalent to the height of anatomic crown or 2/3 the length of the root. Another school of thought says one should leave 5 mm of apical gutta percha in the canal and the rest should be used to prepare post space. However, in short teeth, an absolute minimum of 3 mm is acceptable. Personally, I prefer the first school of thought. Before beginning the procedure, we will first determine the length of the tooth. The length estimated is about 15 to 17 millimeters. So, according to the first school of thought, the length of the post should be 8 to 10 millimeters. Now, let's start the preparation for the post space. On clinical examination of the tooth, one can see that sufficient amount of tooth structure is lost. In such cases, 1 to 2 millimeters of healthy tooth structure is required that can help in achieving the ferrule effect. In case there is any fracture below the gingival line, the success rate of post and core is reduced drastically. As you can see, there is sufficient tooth structure above the gingiva. So, we will proceed with the post space preparation. The post space preparation is done using piezo reamers or Gates Glidden or GG drills as they are called on a low-speed handpiece. Depending on the length of the crown, we require about 7 to 8 millimeters of post space in the canal. Adjusting the length of the piezo to the required length, we will start preparing the post space very slowly to avoid heating the tooth. The piezo number 1 is used first. The length required is measured with the help of a scale. This size of the piezo is narrower than the canal, so it follows the path of GP and does not engage dentin. Only remove part of the GP with this instrument. Do not apply undue pressure on the reamer. Now, the basic post preparation is done. Using successive sizes of the piezo reamer, enlarge the canal 1 or 2 sizes to match the configuration of post. If required, take a radiograph to verify post space. Be careful not to remove more dentin at the apical extent of the post space than is necessary. Ensure that the complete gutta percha is removed from the canal in order to achieve proper bonding of the tooth to the canal. If the coronal portion of the canal space has some gutta percha, this can be removed by using a steel round burr. This burr helps in removing minimum tooth structure and hence is ideal for removing GP without causing much destruction to the tooth. This is a very important procedure because if GP is left in canal, it may be difficult to achieve appropriate bonding for teeth. We are going to use glass fiber reinforced post like Re4 Post by Dental Avenue. This kit of Re4 Post has a variety of sizes available with their respective final drill. In this case, we are using the number 2 fiber post. As I previously said, we have to be very meticulous in removing the gutta percha from the canal as well as the coronal part of the tooth. After preparing with the number 2 final drill, the canal space still looks a little wider. I would prefer to prepare the canal space a little more so that a number 3 post fits snugly in it. Once this is done, we will check the canal space again for any remaining gutta percha. After thorough debridement and cleaning, we will try the post in the canal space for a snug fit. As you can see, the post fits adequately in the canal well. If required, one may take appropriate radiographs at every procedure. Once the size of the post is selected, we will adjust the length of the post. There should be at least 2 to 3 millimeters of post present in the coronal part of the tooth to provide adequate tooth support to the core structure of the tooth. The required length is marked on the post with a marker and the post is reduced to the given length using an aeroter. Once the length of the post is adjusted, it is dried with the help of cotton or gauze and a layer of silane is applied on it. This helps in better bonding of the post to the cement. Simultaneously, an appropriate size of core former is selected which helps in building the lost tooth structure on the post. These co-formers are preformed crowns which are available in various sizes. These preformed crowns are made of cellulose and are easy to adapt of the tooth structure. They are malleable enough, so they can also be trimmed accordingly to fit the tooth. These co-formers make building up a tooth very simple and efficient. Once the appropriate core former is selected, we proceed with cementing the post. The post space and the tooth is etched with 37% phosphoric acid. The etchant is placed for 10 seconds and then rinsed. Etch helps in removing the smear layer formation in the canal space along with any debris. After copious irrigation, the canal space is dried using paper points. Once proper isolation is achieved, we shall apply bond in the canal space, air dry for 15 seconds and then cure the bond. We will use Luxa Bond Total Etch, which is a dual curing adhesive system that comes with a pre-bond and a bond A and bond B. Apply 1 to 2 drops of pre-bond on the etched tooth surface for 20 seconds. One can use a thin applicator tip followed by a thin brush to ensure that the bond is applied meticulously in the post space. Now, mix 1 or 2 drops of bond A and bond B in 1:1 ratio for 5 seconds. Apply this mix on the tooth in a similar manner for 20 seconds and air dry gently. It is advisable to use a dual curing bond instead of a light curing bond. If a light curing bonding agent is used, the light may not reach the apical part of post space, causing insufficient curing of the bond. The tooth should have a wet appearance at this time. Now, I am ready to inject the Luxa Core Dual. As soon as the tooth is primed, my assistant simply hands me the Smart Mix syringe and I inject it into the tooth. I do not have to wait for her to mix anything or load it. Luxa Core Dual is not very viscous and flows very easily into the prep, ensuring complete adaptation to the preparation walls. It does not slump. When injecting it into the tooth, I place the plunger of the syringe into the palm of my hand and do not use my thumb to depress it. This gives me greater control. The post space is filled with Luxa Core Dual and the post is placed. Once this is done, now we will build up the core using the pre-formed cellulose cap. The Luxa Core Smart Mix is injected in the core former. Care should be taken to not let the intraoral tip of the syringe become embedded in the material as it flows out. Once the core is filled, it is adapted on the post-covering tooth and cured for 20 seconds with a PAC light. I am not concerned about fully curing the material since it is dual cured and will set by itself. After sufficiently curing the buildup, the preformed cap is removed from the tooth and excess is removed from the margins of the tooth. The tooth is now modified accordingly using a TR13 diamond point to resemble a lower right canine. As you can see, the margins of the prepared tooth are resting on the tooth and not on the composite. This is the finished core build of the tooth. Case 2. A 17-year-old female patient presented to clinic with pain in lower right posterior region. On examination, tooth 46 was grossly destroyed with pulp exposure. There was no periapical infection. Under proper isolation, the root canal treatment was completed. Once the tooth was completely asymptomatic, a post and core procedure was advised to the patient as significant amount of tooth structure was lost after cleaning the decay from the tooth. A post is generally placed in the wider canal. In lower teeth, since a distal canal is wider than the remaining two mesial canals, a post will be placed in the distal canal. The length of the distal canal is 19 millimeters. Considering the amount of tooth loss, the length of the post was estimated to be 12 to 13 millimeters. Measuring the number 1 piezo reamer to the required length, we start preparing the post space in the distal canal.